Hi, everybody. Welcome to another edition of Eye on Oshkosh. I'm your host, Cheryl Hens. Very pleased. We're doing a different kind of show tonight, one that I've not really done before. But, you know, the healthcare industry and trying to access healthcare is challenging, to say the least, no matter what your age, no matter what kind of health you're in, whether you're in perfect health or you've got some disabilities or other challenges. It's navigating the healthcare system, I think, is one of the hardest things that someone can do these days. But for someone who's deemed legally disabled, it can really be a nightmare. And that's what we're going to be talking about tonight with my two wonderful guests, who I can't even thank you guys enough because you have done so much to prep for this show. So thank you. But so to my immediate right is Melody Nolan, and seated next to her is her BFF, Anna Hirsch. And during this hour, we're going to find out, you know, what their challenges are, what their disabilities are, you know, what is working within the healthcare system, what isn't, and how they're helping each other as friends who experience kind of some of the same things, but not exactly the same. So it's going to be a fascinating hour. I would recommend that if you have any kind of disabilities or challenges in getting health care, keep a pad and paper handy. And if you're listening to this on the radio, you can still have a pad and pencil or paper handy. So, welcome, guys.
Thanks for having us.
Yes,
yeah, thank you.
I will just tell the audience this. I first encountered Melody by, I was asked to write an article for a local publication about some of her challenges and so forth. And we talked for, I think, probably about an hour or so. Mm-hmm. And I thought I had it, you know, I thought I understood it. And the more I kind of looked at everything, I thought, I have no idea what I'm doing. And so I thought that this would be a good opportunity to talk some more, and maybe I can, from here, be a little bit more laser focused on what I'm trying to accomplish. Mm-hmm. So let's, let's talk about first things first. And so Melody, why don't you tell me and the audience a little bit about yourself and the kinds of medical challenges that you face and what your disabilities are.
Okay. Well, my name is Melody Nolan, and I live here in Oshkosh, Wisconsin. And I have been legally disabled since the age of 22. Originally, they thought that it was due to multiple sclerosis. That diagnosis later changed to systemic lupus. And as time went on, I have accumulated more diagnoses, but primarily of the autoimmune element.
So they're all different, but yet they fall under that big umbrella.
Most of them do.
Okay. All right. Got it.
Yes. My primary challenge and the root of my issues is a malfunctioning immune system. I have, one of my conditions is called common variable immunodeficiency, sometimes referred to as CVID, which basically means that my body doesn't produce enough immunoglobulin on its own. Immunoglobulin is basically the foundation of the immune system.
Yeah,
right,
kind of what
yes.
would fight off things.
Right, and so my life revolves around having infusions at the hospital. I have two different types of infusions. One of them is for the CVID, and it is actually immunoglobulin. So I'd like to take a moment, if you don't mind, and thank everyone who donates blood and plasma, because people like me benefit from that. Mm-hmm. So across the board, the symptoms that I deal with are I have chronic pain, I have chronic fatigue, extreme chronic fatigue. I at times have difficulty concentrating and difficulty with long and short-term memory.
Let me just interrupt you for a moment. You
Yes.
said long and short term. What does that mean?
Well, sometimes I can try to be thinking about like what happened 10 years ago. And I'll be thinking about it, and maybe I'll be speaking with someone and they'll say, oh, remember when we did whatever? And I have just no recollection. I'm like, did we have a good time?
We did that?
Oh, I didn't mean it that way. But in any event, and then for short-term memory, it can be as simple as, for example, I have a YouTube channel that I broadcast to, I try to weekly, and someone will be like, oh, when did you do your last broadcast? And I can't remember if it was yesterday or last week or that morning sometimes.
Or a year ago.
Yep.
Right, yeah. So
Okay.
I haven't been doing it that long. So.
Okay.
Yeah. But we frequently ask each other what day it is.
Yeah.
Because that's just what happens.
Hey, I have the same problem. And I think for all of us, with COVID, and we're going to talk a little bit about that in a little bit, how that affected you.
Yes.
But I think all of us, at least for that first year, we kind of were lost. It's like an absent or a stolen year. We lived such different lives. And even part of 2021 was like that. But thank goodness we're, kind of coming out of that a little bit. At least we're able to do more things as a society. So anyway, I'm sorry I interrupted. So go on.
Oh, no problem. So I also have digestive issues, and that's another reason that I have infusions is to treat that. And I have vision issues, a variety of them. The one that affects me the most is basically that my eyes don't focus together. So if I use my eyes too much, just in general, meaning having them open, but particularly if I'm trying to do something like read or watch a video, I get dizzy spells and pain, and it's not good.
Okay.
So yeah, I have a variety. I also get, and Anna can relate to this, I get very severe migraines to the point that I have actually been hospitalized for them once in the ICU as a result of the symptoms. So it's not your typical headache. It's like everything is magnified when you have an autoimmune illness.
Yeah.
You catch a cold, you can't get rid of it. It turns into the flu. It turns into bronchitis. It turns, it just
It snowballs.
everything just snowballs. Nothing
for
nothing
sure.
is simple.
Yeah.
So what kind of challenges, it obviously this affects your entire life because there's not one single thing here that would not impact your life in a very significant way. But what kind of healthcare challenges, whether it's accessing healthcare, finding the appropriate doctor or specialist to care for something, what kind of challenges do you face?
Well, my situation is that I don't have a family. I was in foster care when I was younger. And when you become, or at least my experience in becoming ill at such a young age, it's very hard to maintain relationships, much less build new relationships, right? When people are starting to develop their careers and get married and moved away and you find your niche. I never found a niche.
Yeah.
Okay. And so it's very lonely. I also never really had, frankly, the energy to do much dating. And so I don't have a significant other. And therefore, one of my primary challenges is getting assistance with home care at home.
All right. And why is that a challenge?
Okay.
In a nutshell.
Right, in a nutshell. Okay, so my particular situation, and I am grateful for this, is that I do receive care from a program called the IRIS program here in Wisconsin. And I'm not a representative for them, but my understanding is they're a state-funded program administered on the county level. And so what they do is they assess you and your needs and basically give you a budget. And then I'm in what's called the self-directed program because I'm a control freak. And so it's my responsibility then to hire and train and retain caregivers. I have been blessed with some wonderful caregivers. They tend to be young people, so they're with me a few years and then they go off in those life transition periods.
Yeah.
You know? So when that last happened a couple years ago, starting then, which was about right around the time of COVID, actually. So there's compounding factors here. It's always been hard to find people. Caregiving is very underpaid and underappreciated.
And overworked.
And overworked, exactly. And so it was hard to begin with, but something happened during COVID for the whole healthcare industry. I don't know what, but
Every industry.
But yes, where all of a sudden all the agencies were short-staffed and individuals stopped applying for positions. And the main candidates that I had, how can I put this? Had little or no experience, because this is a job, at least when you're going through the county, where the only basic requirement, there's an age requirement, and you can't have been convicted by a felony.
Okay.
That's all.
Pretty much it.
And that's all. And you need a lot more to be an effective caregiver.
So, okay, and that's a huge challenge because, you know, you want to be independent, you want to remain in your home. And I'm just going to say this, and I know we haven't spoken to you yet, but I know a little bit about what your challenges are. Yeah. Melody has spilled the beans on that. But, so I will just say this. If I did not know from the two of you that you have these issues, I wouldn't know that you are any different from anybody else. I would not think of you as having a disability in some way. And by the way, let me just ask you this, because I want to be mindful of what you guys prefer. A lot of people get worked up and angry if you say that they're disabled. You know, they want you to use other words like they're physically challenged or they're, you know, whatever. So what do you guys prefer? Do you mind my saying disability?
No,
I don't mind that at all.
Okay.
I prefer it, honestly.
Yeah, I prefer saying, you know, that I have a disability as opposed to that I am disabled because there's a lot more to me than my illnesses.
Right.
Absolutely, and that was kind of the point
That's what
that
you
I
were
was.
just
Yeah,
getting to.
I was kind of trying to say that because I don't. When I look at you two,
Right.
I just see very intelligent, very beautiful young women who. You know, I say young because you're younger than me.
I might not be, but
Well,
But yeah, saying disabled is not a bad. It's not a bad word.
okay. Well, I'm glad because you know I find myself when I'm doing this show, as I think a lot of people in life, just in general. You know, everybody is so head up over, you know, got to be politically correct, and you know it's hard to always try to be politically correct. You know, you don't mean anything by saying a certain word or a certain phrase, and yet somebody may just get really angry about it and upset. So I wanted to make sure because I want to say things that you guys are comfortable with. So thank you for letting me say you have a disability or several.
I would like to address what you just said in terms of viewing us. A disability doesn't have a particular look. And a lot of people are suffering in silence, and that can be due to a mental health condition and or physical condition. Most of us have both. But as I said, there are more to us. Anna and I are both college graduates. I actually have a master's degree in counseling.
Wow.
But I have never been able to practice because I've never been able to be consistent. I never know, and this is difficult for my caregivers, from one day or even 1 hour to the next, will I be able to walk? Will I be able to see? Will I be able to speak clearly? I mean, just the basic things of functioning with me personally changed so rapidly that I can't even commit to a volunteer schedule because anything that's on a schedule, I'm not reliable.
Sure.
And it just breaks my heart because, you know, my experience is that most of us, meaning the people with disabilities, contrary to the stereotype of just wanting to sit around and do nothing and have everything hand given to them, are actually highly driven people. And one of the main challenges is kind of a grieving process of coming to terms with what you can and can't do.
Sure. Yeah, that makes total sense. You mentioned mental health issues earlier, and with that, I want to talk about depression, and it's very fitting because if you or someone that you know or someone you love, someone you work with, whatever the case may be, if they are suffering from mental health issues, primarily if they are contemplating suicide, there is a new number that has been rolled out as of the 16th, which we're taping this on the 21st. So this past Saturday, this is something that's been in the works for, I believe, about 3 years or so. It's one of the reasons why you can no longer just call your friend across the street or in another block or around the city or whatever by just dialing their 7-digit phone number. You now have to use the area code with it. And this is why. So if someone that you know or you yourself are feeling very depressed, possibly contemplating suicide, please call 988. It's that simple. Just like we call 911 for other kinds of help, emergency type situations, call 998 for this. I want to double check that and make sure it's, I just said 998 I think, but it's 988. So I want to be very clear about that. Now, you guys can help me remember to say that again before the end of the show. But yes, it's 988. And that's a lot easier than trying to remember, what the...
1-800.
Yeah, for sure.
Yeah.
So, well, we're going to talk more about things with you, but I want to switch over to Anna because you've been silent for so long. So tell us a little about yourself and your educational background, and what kinds of challenges are you having with accessing healthcare?
Get ready.
Well, we have to keep it somewhat short. I mean, it's only an hour program.
I went to school for biology, healthcare science, and neuroscience, and I worked in the field of preclinical research for a while.
Okay.
And after a while, my body just said, "You can't do this anymore." So.
Because why? What were you feeling?
I just get fatigued really easily, and I have a lot of medical conditions. Primarily a condition called Ehlers-Danlos syndrome.
I'm sorry, what was that?
Ehlers-Danlos syndrome?
Ehlers...
EDS. So
EDS.
Yep,
Okay.
EDS, Ehlers-Danlos syndrome. It's basically, there are different types, which range in, severity. I have one of the milder forms, and it basically, connective tissue holds your body together, and in EDS, it is faulty, and so my joints will dislocate, or people typically with EDS are more flexible, but it results in dislocations and just injuries in general.
How often does something like that happen? Do you get a warning that something's going to happen? Like if you're walking to the refrigerator for something, for example, do you get any kind of warning that your knee might be dislocating and giving out, or
Not necessarily.
how does this come about?
I mean, I've lived with it my whole life, but it's basically, hypermobility. So my fingers will bend the wrong way, and that can result in the dislocations or things like that.
That's why she has lovely rings. They're actually
Yes, they're
medical.
splints.
They're what?
They're splints for holding my fingers in the proper position so that they don't dislocate or don't hyperextend.
Oh, how interesting. Can you hold, not that we want to have you on display, but can you hold it up for the camera? I think this is your camera right here.
Yep.
That's...
Yeah,
Don't worry, Roxy, I won't have you get up and zoom in.
Yeah. So I struggle with that every day. And I mean,
That's
sometimes-
fascinating, though. That is. I've never. I just said when I met you, I said, "Wow, a lot of hardware," and I shook your hand.
I joke that the
No
best looking
idea.
splints I have.
I had no idea that those were medical splints.
Yeah.
And insurance doesn't cover them.
No,
She'll
they're
get to all
expensive. $100 a pop. But
For one
for
finger?
one, yep, for these ones, yep, they're $100 a piece, pretty much, 120-ish.
And insurance doesn't cover that?
Nope. They sometimes will cover some of them, but not as many as I need.
Well, how do you pay for something like that then?
Good question.
I mean,
Credit card.
seriously. I
This
mean,
is why I wanted her on. This
Credit
story.
card. Honestly, it's the expenses that people accrue when they are disabled or when they have chronic illness. Oftentimes, a lot of them are not covered by insurance. A lot of my supplies, whether it be splints or supplies to administer like my IV medications and my IV fluids, so like this is support. It's like an IV when you're in the hospital, how they give you meds. A lot of those supplies aren't covered, so I've been having to come up with, it's like $1,500 a month for the supplies that I need to administer my meds. And
do you work at doing anything?
No, I'm on SSDI.
Okay.
But then, as a result of needing all these things that aren't covered by insurance, I had to pick up a part-time job. I'm very limited in what I can work just because of all of my conditions.
Sure. Yeah. So, what about like Medicaid? I mean, does that?
Yep. They don't want to cover the things I need.
Do you get any Medicaid?
Mm-hmm.
You do.
Yep. The problem I have is they will cover the things I need for my IV fluids every week, but I do IV meds in addition to that, like probably 10 to 12 times a day. And I have to get them through a retail pharmacy versus my special infusion pharmacy. And so infusion pharmacy will not provide me any of the supplies I need for those meds because they don't supply them to me.
I am dumbfounded, really. I'm awestruck about this. I mean, what? Well, it's kind of a rhetorical question, but what do they expect people to do? Have you? I would imagine. What's your educational background? What degree do you have?
Biology, healthcare science, and neuroscience.
So you have a bachelor's, or do you have a master's?
I have a bachelor's.
Okay.
Yep.
So bachelor's, master's. So I'm sure that you advocate very well for yourself and for each other. So when you have conversations with, say, for example, the Medicaid people, is it Badger Care?
Right. Yeah, I'm on Badger Care right now.
Okay. So when you have conversations with Badger Care and you say, listen, I need these splints, do you have any other splints?
I have braces and splints for every part of my body.
And so the other things, does it cover the other stuff?
It covers some of them, yeah.
Okay.
Like, it covered my neck brace. I have ankle foot orthotics and things like that, and those were covered. But things like these ring splints, they don't like to cover them for whatever reason.
They don't like to cover them. But if you put up a big enough stink, would they?
I don't think so.
Have you
I've been fighting
contacted,
for,
like, I know from knowing someone else who's on Badger Care that they have, and I'm going to stumble on this word probably, they have like an ombudsman. I mean, have you dealt with an ombudsman at all?
I mean, I've gone in circles talking to everybody that I can think of, whether it be like my caseworkers at my insurance company, at Medicaid, or just various different people that they've suggested I contact. And like in regards to like my IV supplies, nobody can figure out how to get these things covered. Nobody has any suggestions.
I just don't understand
So they
it.
give her medicines, right? But not what she needs to be able to administer them.
So they'll cover like the vials of medications I need for my IV meds, but I can't give those to myself if I don't have, the syringes and needles without the saline flushes, because the saline flush is what pushes it into my bloodstream. And without that, it's pretty useless. And these are the things I rely on day to day, especially because I have another condition, mast cell activation syndrome, and it causes allergic reactions. And so as a result, I'm on IV Benadryl 4 to 6 times a day to try and keep me from needing EpiPens and going into anaphylaxis and having to go to the hospital.
And we all heard what EpiPens, what that cost,
Yep.
skyrocketed to like 300 or 400%.
Yeah. No,
a couple of years ago.
Yep.
And not as a result of COVID. That happened prior to COVID.
And back then, there was a week that I needed 6 EpiPens in a week. So you can imagine how pricey that gets for somebody, especially if it's not covered.
So I am serious. I mean, you're working a part-time job. You're putting some of this on a charge card. But at some point, charge cards get maxed out. And I don't want to dig into personal finances or anything like that. But at what point can you just no longer afford some of these things? And then what?
Right. Well, either you go without, or I found a really good resource is on Facebook. There are supply trade groups. So certain things that aren't like prescription medications, you can, if you have extras, send them to somebody else. And so oftentimes, if I have extra supplies of something I don't really need anymore, I have excess, I'll post it in there, and likewise other people do that. And usually in those groups, they'll post it and they'll say it's free for shipping. So if you pay, like the $20 for a large flat rate box, they'll put whatever in it and send it to you. And so that's been my saving grace, really.
Yeah, at least there's that.
Yeah.
But she never knows from month to month.
But it's hard, it's hard to tell.
And especially with shortages, it's scary.
Yeah.
The answer to this is it's scary, and we don't know what to do.
Right. Now, I don't know if this will be any help to you at all. Sorry, people, I just banged my microphone. I don't know if this will be of any help to you guys at all, but I know that the Lions Club, internationally, well, nationally for sure, probably internationally as well, they have all kinds of supplies. So, for example, I know you have a wheelchair, but if you needed a wheelchair, they will just bring it to you. They don't charge for it. They just say, use it. When you're done using it, please return it to us. And I think that that's something that a lot of people don't know anything about.
I actually utilized that before, because insurance didn't want to cover a wheelchair for the longest time. It wasn't till August of 2021 that I finally was able to get a wheelchair covered.
What's their excuse for not covering some of these things? I mean, I just don't understand what in the hell they're thinking of here.
The problem is they base it on, I believe, Medicare rules, where you have to be homebound. You have to be able to use it in your home. So if your house is not accessible and you don't use that wheelchair in your home, they're not going to cover it. You can use it when you're out and about and primarily use it for that, but you have to also be using it in your home.
And they use, so Medicaid relies upon Medicare rules for a lot of this stuff.
Wheelchair-wise, I don't know for sure, but I am fairly certain that is the case.
Okay, well, half of our hour is gone already. I know that I put you, Melody, in touch with State Representative Gordon Hintz for our area. When I first contacted him, he and his family were out of the country on a vacation, I'm assuming. And he is not running for re-election, but he or someone from his office was in contact with you, correct? Have they been able to do anything for either of you ladies to help in some shape, form, or fashion?
So far, I had a conversation with someone in his office, and what she did was refer me to someone at DHS. I've gone that route before, but this is still a different person, so I can be hopeful.
And that's Wisconsin DHS, or that's okay?
Wisconsin, yes.
Okay.
And so I'm hopeful, but I'm also skeptical, just based on experience of how hard it is to change the system, basically.
It really is.
Is there a support group out there? I know you've got this group where you can get things, but is there a support group out there for folks like yourselves?
There are a lot of different support groups. Primarily that I've used are on Facebook. There's various ones, whether it be for a certain condition or just chronic illness in general. And through exchanging supplies with people, I have actually, gained some friends from that, because we will exchange pretty frequently.
Sure.
And so we just try to support one another in that way.
Sure. Well, and Melody, you were talking about you don't really date and so on and so forth. Have you, not that I'm trying to set you up here, but, have you looked on Meetup to see what kinds of local groups might be out there to, I don't know, provide some support, not financial support, well, there might be someone out there to give financial support, but emotional support. I know you two lean heavily on each other, but there's times when you need more shoulders to cry on, and it sounds like, sadly, you don't really have that.
Yeah, I am fairly or relatively isolated. Given my immune conditions, I am basically advised to isolate. So, for example, you mentioned COVID earlier. A lot of people were so, I feel like I'm in jail. I can't go out. I can't see my friends. That was my everyday life.
Right.
And
that's how we feel all the time.
essentially still is. So I like to try to use COVID, the shutdowns, as an exercise in empathy for people like us.
Yeah.
So it's often recommended to me that, how about online support groups, etc. Anna's really good with that. With my eye problems, and there is adaptive equipment, etc. But it makes it more difficult, and I'm also just skeptical. I see a lot of competitions as to who's the sickest, and who has the
well, that's
kind
just
of like
sick.
attention.
It's a really
not
big
to use
problem.
the word.
Yeah, attention
It is.
seeking.
It's a problem in the chronic illness community.
Yeah, so I kind of stay off of that and have my small circle and my music therapy. So helps me work through things.
Yeah, I wanted to get to that for sure. What kinds of things? Well, let's talk first about this IRIS program, IRIS. What exactly is it? What does it do? What does it not do?
Okay, so basically what it is funding for seniors and people who are legally disabled who are also low income and on Medicaid as a result.
Okay.
Those are to my understanding, the basic requirements. So what they do is they provide a budget, and so they will pay for in-home care if you can find people to do it. They will pay for in-home care. They will help pay for some medical transportation, but it has a lot of issues. And they will pay at times for, if your doctor says that you need a lot of supplements or something that's not covered by insurance, sometimes you can be approved for that. And they will also, if your doctors and rally for you, approve other services such as acupuncture, massage, music therapy, art therapy. But you're very limited because you're limited to the providers who are willing to contract with the IRIS program. So you can't just go to anyone and say, bill IRIS, the way you would say, bill my insurance. So I thank everyone out there who takes the time to work with the county to provide in-home services to people like me.
So you've mentioned music therapy a couple of times, acupuncture, acupressure, probably chiropractic for some people. What do you do? I know that you do music therapy. And so tell us a little about that and what that is and how it benefits you.
Okay. So there is a huge, there's a shortage in everything right now, but that includes mental health professionals. And I have struggled with mental health issues since I was a child. So it's nothing new, but it's compounded by living with chronic pain and illness and the isolation that results from that. And so I fortunately am at a part in my process where I don't really need standard talk therapy anymore.
Talk therapy.
Yes,
where you go in and you actually talk to
and
a
you actually
therapist.
talk, right? Just the standard one.
I figured that's what it was, but I wasn't sure.
Cognitive things, analysis, etc. And by nature, Anna and I are both very creative people, and I just got very lucky. I had an Irish social worker who said, we have a music therapist that just signed up with us. Would you be interested in that? And this is not a requirement, and it's actually kind of a blessing and a curse, but I do also have extensive music background. And I was like, sure, I would love to meet her. Now, she primarily works with autistic children. And I was like, hi, I'm an adult, I'm depressed, help me. And she said, I don't know if I can, but I'll follow your lead and we'll try and see if it works.
Okay.
And it has saved my life, literally.
Mm-hmm. So what do you do? What really, say I'm going in for music therapy for the very first time. Mm-hmm. What am I going to be doing? Are you writing music? I know that you write lyrics. Mm-hmm. You sent me a beautiful song that I forget what the melody is.
Top of the World by the Carpenters. Is that the one I sent you?
I don't think so. It was something
version?
else, I think.
Oh.
But you've written, it might be. But you've written lyrics to these melodies. Mm-hmm. No pun intended. And so I think it's really wonderful. I was blown away by what you sent me. And so is that part of your music therapy? Is that what you do? Or what does a music therapist do for folks?
Okay. So what my music therapist said to me was, my job is to meet the needs of the client, whatever those needs are. We start with music, but it can lead anywhere. And so if you're like mine is, primarily working with kids with autism, you may be developing motor skills, communication skills, through the use of instruments. Mm-hmm. If you're working with people who are, and at one point I was, bedbound and not very functional with little promise, they may be working more like she brought me a harp so that I could feel the vibration of the strings and interact and get comfort from the vibration. So these people are well versed in all types of therapies, and so what your treatment is going to look like is going to depend on what it is that you need. Mm-hmm. So for me, I have a need for expression and just like getting stuff out, and to be witnessed and to be heard and to have someone say, like you just said, I listened to your song, I'm like, thank you, I feel heard. That
well, thank you for sending it,
that
for sharing it with me.
Yeah, that's what my YouTube channel is in essence.
That's like, and while you're saying that, I will just say this: if you go to YouTube, and this is good for the folks listening on radio also, but if you go to YouTube, and then once you're at YouTube, type in user / everybody, you do a / and people call it a \. That is so wrong. It's a / I am twirling for the number 4 joy. So again, go to youtube.com, and then once you're there, in your search bar within the YouTube channel, type in user / I, the letter I, not I like I on Oshkosh, the letter I am twirling, like you twirl a baton, number 4, and the word joy.
But the easier way to find it is to type in Melody Nolan. N is in Nancy, O-L-A, N is in Nancy. There are 2 of us, but you'll be able to figure out which one is me.
And you just let me go through that not once but twice.
I didn't want to interrupt you.
Well, please.
So anyway, to answer your question, for me, when I started my music therapy, I was finding songs online that I could relate to. Mm-hmm. And so I would be like, hey, Kathy, listen to this. And then we would talk about what I could relate to in the song. Mm-hmm. And we often send each other songs just as out of compassion or thinking of you or whatever it is.
Yeah.
So a lot of it, that's how my therapy started. Sometimes I draw to music and would tell my story that way with the music therapist. I didn't see an art therapist, but I could. And then it just kind of morphed into writing lyrics to existing melodies. And the reason that I do that is because it gives me a nice little framework. Here's how many lines I have, here's how many syllables I have, here's a rhythm, you know. But I do have a few original songs, one of which I'm working on now that addresses school safety. So I'm looking forward to putting that out. Yes.
For like elementary school children?
For anyone, just
what kind
because
of safety are we talking about? Like because
because
of
of
the
all
mass
the-
shootings?
Yes.
Okay. All right.
Yes, it addresses that, and the song basically talks about how for me school was my safe place, and what does it feel like to not feel safe next to the student sitting next to you?
Yeah.
You know,
Or
so,
just sitting at your desk.
Yes. So I use
Trying to
music and lyrics in particular, but with the help of the music therapist, actually, in this case, composing some original songs just to address it. Because I'm a very emotional, empathic person, and this stuff really gets to me. And as I said, I need to express. I need to emote.
You need an outlet.
Emote, and that helps me. So
Did you say that you draw also? You listen to music and you draw to it?
yes.
Explain that.
I've actually done this on my own since I was a kid. I've just put on music when I was a child, I did it more to classical music. I have more of a classical background. Now I'll listen to a song that touches me or even one of my own recordings and just draw. More often than not, it's pretty abstract, but you can tell from colors and whether things are curved or straight, what they might kind of represent. We talk about it, and it's, I don't do it consciously, but then in looking at it and interpreting it, kind of like interpreting a poem, I'm able to sometimes identify what I was trying to express. But Anna, unlike me, is an actual visual artist. This woman can draw. I mean, I can't do that.
So you do that as a type of therapeutic thing?
Yeah, I use it.
And do you have, do you do art therapy?
I don't have an art therapist or a music therapist. No,
Okay.
I've just always, my whole life, been very involved in the music community and doing musical theater and things like that.
Do you play an instrument, or is that?
I not so much anymore. I know how to play the violin and a little bit of piano by ear, but primarily singing is what I've always done.
Is just out of curiosity, because your joints can just displace. Does that factor into not being able to play an instrument now?
Yeah, absolutely. And actually, I also enjoy art too, and use that as a means for helping with my anxiety. And I just actually got an iPad because it's a lot easier on my joints to be able to use the digital pencil on an
or
iPad.
a stylus.
Yep.
Sometimes
it's easier for me to
works.
do it digitally than it is to do it with physical supplies.
Yeah,
I love doing
with
that
a canvas
too,
and all that.
but it's very hard to do when I
that would
don't
be
feel
hard.
well or with my joints as well.
Yeah. I mean, you can lay in bed and do it.
Yep,
you know,
and that's,
so.
I was really excited to finally be able to do art again, because it had been so long since I could, because it just wasn't feasible.
Technology is wonderful when it works and when it meets a need that we have, So your therapy is covered under the IRIS program, but not all music therapists or therapists in general, not all those people, not all the acupuncturists and so forth, they're not all covered or within the IRIS program.
Right. They need to specifically contract, and I don't know how complex that process is. I don't know if they get paid what they're worth, their standard rate or anything.
Well, and just as a disclosure, Melody put me in touch. She gave me some phone numbers, and I did try to reach out to people at the state level within the IRIS program and just the Department of Health and Human Services, and both for the article that I'm writing and for this program. And I guess I should say I was surprised, but I'm really not. I'm disappointed that you get the bureaucratic BS when you're trying to nail down problems, right? If you want to enroll in a program, sure, they're all ears, and they'll get you enrolled. But if you have a problem that needs to be addressed, forget it. And they did not want to talk to me.
Nope.
I'm sure.
That's the biggest problem is like
They pushed me, they palmed me off from one to another to another.
Yep.
And that's our experience
Yeah.
as patients.
And,
really
and
is.
I ended up getting a mouthpiece, basically, who has a script and what they say, and that was of no benefit to me in trying to put together an article or
Right.
even this show
yeah.
with you guys as guests. So,
May I give an example of like questions that I've asked you to try to work on, or we're kind of out of time for
well,
that?
we're down to probably about 12 minutes.
Okay.
And I know that there's some things you guys really want to get
Yeah,
to. So,
Stay tuned for her article. Then we can get into the nitty gritty.
well, not everybody who's watching this gets the paper, but
I'll post it.
oh, I don't know if you can do that. That might be a violation of copyright.
Ooh.
So I wouldn't do that.
Okay.
They can see it online though. The newspaper.
That's what I mean. I'll post the link.
Yeah, there you go.
There we go.
That helps.
Problem solving.
So, but if anyone's watching who works for the DHS or the Medicaid program here in Wisconsin or whatever, you guys, I know you're limited on what you can and can't do, but I think you guys need to do a better job trying to help people, the very people that you are being paid to serve. And again, I know that you're limited on what you can do. I know budgets. You have budgetary constraints. I understand all of that. But you can't just say to someone like Anna here, we're not going to cover your finger splints.
Right.
Lay out the $3,000 or whatever it might cost yourself. And they don't give you, it's like when the state gives communities unfunded mandates. You're expected to do A, B, C, and D, but we're not giving you a penny for it.
Right.
You find your own funding.
Well,
Unfunded mandates are very much like what this
yeah.
is.
Well, and the system that the very people that the system was made to help, it doesn't help us.
It's failing.
It fails us, and we're the very people that it was created in order to maybe give us some support and help.
So what can people do to help you guys? Like the general audience. I've already yelled now at DHS. But what can people do to help you? Or now we're down to about 9 minutes. So tell us how people can help you and what else you might want to know or you want people to know.
Well,
I think a lot of people, myself included, are pretty discouraged right now with the political system. But please don't give up.
yeah.
Because if we give up and we don't vote, and actually, this is the hard part, take the time to educate yourself about the candidates. That really is the only way that we can affect change. The issues that I want to address with Iris go back to DHS regulations, Medicaid regulations, and Medicare regulations.
Yeah.
And some of that's is governed by the federal government.
Right.
And then a program like IRIS is governed by and funded by and so forth by the state.
Right.
Correct?
Right. So
And
you need
so-
to be aware at all levels, and
Right.
it's time consuming and it's challenging and it's hard to know who to believe.
It is.
But try to do your research.
Yeah.
And then I guess the other thing for me, it does help. What changes my life but does not meet the practical needs that we're talking about in terms of actually receiving care or funding or medication or whatever is just to if you are friends or have a relative with someone in a situation similar to us, just to listen to us, be patient, understand that we mean no harm when we're tired or unreliable or can't do things, but still value us and our opinions.
Yeah.
And it's like, what I can't stand is when people say, well, Melody, you know I love you. And I'm like, but I haven't talked to you in 3 months. I'm not psychic. I don't know that. So basic communication skills
Yes.
that are healthy for everyone.
Right,
Healthy
right.
or not
Yeah.
are especially important when you're dealing with people like us. And Anna and I are both very upfront with each other, for example, in terms of what we can and cannot do in any given day, whether or not we're up to talking on the phone, whether or not I'm okay reading a text. I mean, just anything, and just
be willing to adapt and, work with whomever it is, your friend, your family member.
Right.
Be understanding and just, try to adapt so that they're comfortable and you're comfortable participating.
Right, and then also I try to, with the few people in my life, my little circle, also encourage them to tell me how they're feeling, because I know it's hard for them to see us suffer.
Right.
It's hard for them, and they need to set boundaries with us as well, so that they don't become overwhelmed and
Sure.
disappear. So I encourage open, honest communication.
Yeah.
Yeah.
Well, and again, to the audience, I will say this. Years ago, I mean, not like a decade or so ago, but a number of years ago, I had a woman on this show, and she was working with the city parks department to get an adaptive playground. Mostly for kids, but also making it adaptive to folks, adults, in wheelchairs or whatever. And that finally became a reality. And so I would say to folks out there in this Oshkosh area, Winnebago County, whatever, state of Wisconsin, if you are kind of a mover and a shaker, or this story has moved you to maybe do something somehow to help folks like Melody and Anna, I would say please use your connections, use your network to help make a change here, either a change within the system, the DHS and the IRIS system and the federal government, Medicaid, Medicare programs. I know that sounds like a monumental goal, but, baby steps. That's what we all need to do in life sometimes, and baby steps are what it takes. So, if you've got great connections and you're someone who is as awestruck as I am about this situation, and believe me, there's not just the two of them. This probably affects thousands or hundreds at least across the state.
Thousands.
So, please do what you can to help. And if you have questions, reach out to these ladies. Melody, can someone contact you through YouTube?
If
they
they
probably-
leave a comment on a
yeah.
video, they can. But
So
I'm
let's-
happy to give my email address.
Yeah, so let's do this. Well, you go ahead, because I've already said twirling for joy too many times, and I didn't need to.
But that is my email address. Okay. So
Twirling,
the word
like
twirling.
twirling a baton, the
And the
number
number
4, and the word joy,
at
gmail.com.
Exactly.
That's so much easier.
And please
And-
just put I on Oshkosh in the subject line, so that I know you're not spam and don't delete
Yeah,
it.
or up to no good of any kind. And then, Anna, you're on, I don't think we have your email address, but you are on both Twitter and Instagram.
Yep, I prefer Instagram, and it's just
Okay.
my name, Anna, ANNAC, and then my last name, Hirsch, HIRSCH.
Yep, and they can get that off the screen there. So it's Anna, and then a C, and then the word Hirsch. Can we put their names up one more time, guys? So that, there we go, Anna Hirsch, and in between there's a C. So I think that, people should be reaching out to you if they're, if they think they can help, if they have concerns, if they want to do anything to help in this situation.
If you're not on Instagram and you want to reach Anna, just go ahead and email me.
Yeah.
Okay. Twirling for joy at gmail.com. So with about 3.5, 4 minutes left, tell us a few things. Besides the music therapist, do you guys have providers that are actually doing things right?
Yeah.
I do. The main thing that they do right, I'm thinking of a couple in particular, is to actually take the time to consult with each other. So the right hand knows what the left hand is doing.
Communication.
Okay. Again, communication. Yeah.
Yep, that's huge.
Now, real quickly, I know that you had a situation where you had to see no one around here wanted to help you.
Yep.
They
There's a-
referred you to a provider
Yep.
up in Green Bay.
Yeah, I've been referred all over. It's really hard to find any specialist that's willing to take on my case because I am very complex and I have a lot of different illnesses and they interact in a way that most doctors just aren't comfortable managing that. Specifically in the area, the gastroenterology doctor is what I'm having the biggest issue with. There's no one local that's willing to take on my case.
And who have you contacted? Like what groups?
I've tried Aurora, Ascension, you name it. I've
Theta
tried.
Care?
She's been to
My GI is
Madison?
actually, yep, I consulted a GI at UW in Madison, and then I have a GI down in Grafton. But
Which is by the
even
Milwaukee area.
they are more hesitant, and they're not really, willing to do a whole lot, especially the one in Madison, because I'm not local.
But have you checked with Theta Care?
Yep.
I find that interesting because Theta Care is tied in with, I'm having a brain freeze on this, the big hospital in Minnesota, Mayo Clinic.
Yep.
Thank you,
Oh, I've
Rox.
been denied for there. I tried. I applied to be seen there, and they said, well, we can't do anything else for you.
Me too.
That's very disappointing. That really irritates the crap out of me.
So not only
Because
is
Mayo is supposed to be premier.
Yep. So not only is there a shortage of these specialists, you're facing the problem where they won't take on your case, and then you're left with
Are
no
they
one.
qualified to, and they just won't?
A lot of them, yeah. They just, when you're as complex as myself, or
Have you
even
spoken
as
to an
Melody,
attorney?
not in regards to that, just for disability.
You may want to consider it,
Yeah.
seriously.
She has to go out of state for her heart specialist.
Yeah. Yep.
It's terrible. All right. Well, I know we could talk for another hour.
Oh, yes.
There's questions that we didn't get to, and I am sorry about that.
No,
but
thank you for having
I
us.
think that we have put out some good information. And, again, they don't want your sympathy.
No.
They want to be treated as human beings, but they also want their illnesses treated and paid for, when they really should be. So, but thank you guys very, very much.
Thank you.
I
for
do
having us.
appreciate it. And I will probably be reaching out to you again for some other stuff. But so before we close, I just want to say that I am on the search for some additional volunteers to work on this show. You don't need to have any training. I mean, you don't need to have any knowledge. We will train you free of charge. It's a volunteer thing, and so you don't get paid. But it's a lot of fun, as you can tell. We have a lot of fun here. You learn a lot. You meet a lot of cool people, and it just requires about 5 hours a month. We tape the first and third Thursdays of the month, and so it's about an hour and a half or so on those Thursdays. And we need more folks. So if that's something that you are interested in, I would thank you in advance and encourage you to contact me at Oshkosh. I like the eyeball. It's on your screen right now, ionoshkosh@gmail.com. We out of time, Rox? Probably pretty close. All right. I'm going to say thank you again to my guests. Thank you to my crew, as always. And most of all, thanks to you. We appreciate you watching, and we appreciate you listening to us on the radio. If you can do anything to help here, I would encourage you and thank you in advance for doing that. That's going to do it for us. We will see you next time. Until then, take good care. Keep your eye on us. We've got our eye on Oshkosh.